On this episode of Healthline, we're discussing HIV/AIDS and learning about the services of another of Fulton's community partners, Positive Impact Health Centers. Employees there help with the physical and emotional toll HIV can cause and offer additional support services as well. That's coming up on this episode of Healthline. Welcome to Healthline, everyone. I'm Lyn Vaughn. As we say often in the world of health, testing is prevention. And as HIV/AIDS continues to impact our region, Fulton Health is working with a number of partners to make testing readily available and clients who need it placed into care. Now, according to the Centers for Disease Control and Prevention, overall, an American has a 1 in 99 chance of being diagnosed with HIV at some point in his or her lifetime. But that risk is greater for those who live in the South, like we do here in Georgia. The CDC says the risk is 1 in 51 for Georgia residents. Now, joining me to talk about statistics in Fulton and how one organization in particular is combating the problem is Olivia Chelko-Long. She's Vice President of Development and Communications at Positive Impact Health Centers. Also, we have with us Preston James. He is a prevention specialist there. Welcome to both of you to Healthline, and thank you for being with us. First of all, tell us a little bit about Positive Impact Health Centers.
Sure. So Positive Impact Health Centers provides client-centered care for the HIV community to have a life worth living. We serve the 20-county metro Atlanta area through 2 locations, one in Duluth and one in Midtown Atlanta.
Okay, and what are the kinds of services that are available?
Sure, we provide comprehensive care. So we provide everything from HIV specialty medical care, mental health counseling, addiction treatment, supportive services, which can range from anything from housing to nutritional counseling. We also provide transportation assistance and then also prevention and testing to the Atlanta community.
So we've heard the statistics, and of course you know them well. What is the key to reducing the rate of HIV infection?
Sure, we believe in a multi-pronged approach. So basically getting people in for testing, getting the prevention messages out there. Once someone is diagnosed, getting them linked to care. Our agency tries to get individuals linked to care within 72 hours of a diagnosis. So after that, it's getting people retained in care and having long-term retention in care and viral suppression in our patients. Because once an individual is virally suppressed, they're at very little risk of transmitting HIV to another person.
Well, I want to bring Preston in on this conversation. Let's talk a little bit about prevention and what your ideas are and what you do at the clinics to help keep the infection from happening in the first place.
Right. So like Olivia said, we do HIV testing at Positive Impact Health Centers. The Mr. Center is a program of Positive Impact Health Centers, and I work in the Mr. Center where we offer no-cost rapid HIV testing where someone comes in on a walk-in basis. They will do an HIV test if they're negative using a small blood sample, and that result we will get within 1 minute. So before the client even leaves the room, they will get a result from their test.
I've got to ask you, Preston, is MR an acronym? And if so, what does it stand for?
It is an acronym. MR stands for Men's Information Services, Testing, Empowerment, and Resources.
Oh, that's a mouthful.
It is. And also apart from HIV testing, we offer STD testing and treatment for gonorrhea, chlamydia, and syphilis. We also offer hepatitis testing. We also have a wide range of risk reduction services through our WRAP program. We do a program called MET Goals, which helps an individual achieve a certain prevention-related goal that they want to work on through 4 different sessions. We also have a program called TLC, which is a group level intervention aimed towards young individuals with HIV.
And I understand that the young people is where the rate of infection is rising. I wonder if we know what causes that, and how do we get them into testing? How do we get them to your place of business?
Well, we have a pretty strong standing in the community. A lot of people come to us through word of mouth because their friends or their brother or their cousin came to us and they had a good experience regardless of the outcome, the result that they received, because they know that if they tested negative at their last test, we try to help them enroll into services that will keep them negative, such as our PrEP program, which stands for pre-exposure prophylaxis, which is a medication called Truvada, which is a once-a-day medication that can help reduce the risk of contracting HIV.
And we have that here in Fulton County. But how popular is your PrEP program?
It is pretty popular at this time. Within a few months, we have over 100 individuals enrolled into our program, and we are going to expand that further to help reduce the rate of new HIV infections. And then, like I was saying, people coming back to us, even if someone tests positive for HIV, we are very good at helping them get linked to care, whether it's with us or another clinic that may be close to them. We want to make sure that, like Olivia said, we get them linked to a medical provider to help get them on antiretroviral medications to be virally suppressed.
So I understand the money that Fulton has awarded nonprofits that goes to your center, your health center, is going to your department. Tell me what will happen with that money that you got from a Fulton County grant.
That's correct. We're funded by a few different grants. We do almost 5,000 tests for HIV every year. And so the grant that we were awarded by Fulton County will help us with about 900 of those HIV tests. So it's a big chunk of our testing that we do annually.
All right, we are happy to help. I'll let the Board of Commissioners know that.
Please do. Thank you.
Yes. Now tell me about some of the other services available at Positive Impact.
Sure. So we have both services in each location, all of the services. So one of the things that our supportive services department does, client services, is housing, making sure people are stably housed, because once they're stably housed, they're more compliant with their medications and they can achieve the viral suppression. All of our programs, the mental health, the addiction treatment, that is the ultimate goal, for people to stay compliant, for people to stay retained in care, to be keeping those lab appointments, to be keeping those medical appointments, to be taking their medications to reach that viral suppression. So all of them have that same goal.
What's your biggest challenge? Is that one of the challenges, getting people to stay committed to the programs?
Yeah, it's all an individual person's risk of falling out of care. So whether that be housing, whether that be untreated mental health, whether that be an addiction issue, or transportation. Transportation is a huge barrier in both of our locations, especially in our Duluth location, because there isn't, the Gwinnett transit system is good, but there could be improvements of that. So all of our services have that ultimate goal, but each individual has a certain other barriers. Each person has their individualized barrier to being retained in care. So we work very closely with each patient. Our case management department works very closely with each patient to determine what those barriers might be and get them linked to whatever services at the agency is appropriate for them.
Okay, so remind us again where you're located, in two places. And also tell us the best way for clients to get in touch with you, those who need services.
Sure, so our Midtown office is at 1117 West Peachtree Street, and our Duluth office is at 3075 Breckenridge Boulevard, Suite 415. And the best way, all of our contact information is on the web. It's www.positiveimpacthealthcenters.org.
Okay. Well, Olivia and Preston, thank you so much for being with us.
My pleasure.
Thank you.
I'm delighted to have met both of you, and good luck with Positive Impact Health Centers and the work that you do. Very, very important.
Thank you so
Thank you.
much.
When we return, we'll learn more about the mental health services provided through Positive Impact Health Centers. Stay with us. We'll be right back. Welcome back to Healthline, everyone. I'm Lyn Vaughn. Now we're talking with one of our partner agencies in the county's fight against HIV/AIDS. Positive Impact Health Centers offers HIV specialty care and support services, including the all-important behavioral health services such as substance abuse treatment, and that is in addition to the HIV testing and prevention services we just talked about. Now, joining me to talk about the behavioral health services offered is the clinical director of Positive Impact Health Centers, Dr. Gwen Davies. Dr. Davies, or Gwen, might I say?
Gwen.
Okay, welcome. Welcome to Healthline. Thank you for being with us.
You're welcome.
Tell us, we just talked with Olivia and Preston about people coming in with challenges and needs that go beyond the direct services that you provide. So I take it that some of them need behavioral health services. How do you determine that?
Right.
And why is it important?
Well, people come in a couple different ways, and we like to say we're integrated care. And so we like to say any door is a good door. So some people know that they need mental health services. Maybe they've already been in mental health services, or somebody's really identified that in their life, so they come directly into mental health or into substance abuse treatment. But other times what happens is that somebody is identified in the clinic. They finally tell their doctor that they're not sleeping, that they're crying every day. Some type of mental health symptom is identified that way. Sometimes they come in through testing, and maybe they're really upset about testing positive and they don't know how to handle telling their family, for instance. It's pretty rare, but occasionally we get people that are so upset that they have suicidal thoughts immediately after testing. But that's something that we can handle immediately. We go and meet with them that day while they're still in the testing services and make sure that we get that handled, that they're okay to leave, and that they can come back and see a therapist starting right away.
And so what are the behavioral health services that you provide? Is there individual counseling, group sessions? Tell us about it.
Yeah, we do individual counseling, and we don't have a session limit, which is really helpful, because what we see is some people they don't need just 1 or 2 sessions.
Right.
They really need a longer term kind of a thing. Sometimes they've been carrying all kinds of pain and trauma, and that's maybe even part of what ended up putting them at risk for HIV, is that they were masking some of their trauma maybe with drugs and alcohol, which means that they engage in riskier behavior, or maybe they have a diagnosis like bipolar, which can sometimes put people at risk because during manic episodes they may do things that are also risky in terms of HIV. So sometimes people come in and that's kind of why. So we do individual therapy. We do psychiatry. Some people do need medication, some people don't, although we don't do medication for people that are not in therapy because we don't have enough of that resource, and we feel like that's better met by other agencies.
Absolutely.
We also do substance abuse treatment, and those are intensive outpatient treatments. So people come in really at a point where they need a lot of treatment, and they're in our services for months, and they're there 15 hours a week.
Wow.
Yeah.
Now, how do you get someone interested in behavioral health services who doesn't know that he or she needs that?
Yeah.
And I know that can happen.
It does happen.
Because there's still a stigma surrounding just getting counseling services.
There is a stigma, and I think what makes the difference more than anything else is it's one thing in theory to go to see a therapist. It's another thing when you meet an actual human being and they really listen to you. And I think that's the benefit of doing that integrated care model, is that way, if you're seeing your doctor who you trust and your doctor brings you in somebody else and they turn out to be somebody who really sincerely wants to hear about what you're going through, you're much more likely to continue than if somebody just says, I think you should go to therapy, let me give you a card. Like doing that warm handoff makes a big difference. We also do substance abuse treatment navigation, and that's kind of a similar question. What do you do when somebody's not really ready to quit using substances? And we meet with them and just talk to them about where they are. We use a technique called motivational interviewing, which is really about the client leading and helping to deal with their own ambivalence around whatever the behavior change is. And that usually can get somebody to a place where they say, well, maybe I'm not ready to go to treatment yet, but I could start seeing a therapist, or I could start coming to this support group. And we do support groups as well.
That is so important. I don't know anyone, including myself, who's ever had therapy who doesn't just swear by it and value it tremendously in his or her personal life.
Yeah.
It's just so important that you do that. Now, there's also a stigma about people having HIV,
Absolutely.
never mind getting to the counseling.
Absolutely.
And so how do you deal with a person, A, who may the person who's feeling suicidal because he's afraid, or he or she's afraid of what people might say. How do you
Right.
deal with that?
Well, you know, that's a big issue. And what we know is that somebody with high stigma, so they feel like they're being punished by their HIV, they feel like they have to keep it a secret, you know, any kind of thing like that, a dimension like that, they're going to have a lot of psychological distress.
Yes.
And what we know is that even if we meet with them even 4 times, so we can bring that down quite a bit, because the main things that reduce stigma are connections with other people who are positive. So we use a peer counselor. So for instance, in our behavioral health clinic, we give people a questionnaire about stigma. If their stigma's high, they're immediately connected with a peer as well as a therapist. And that way, that comes down a little bit faster, and also more information about HIV really reduces stigma. So that's kind of how we handle it, is that kind of shame, just deal with that head on.
I'm surprised that it's still around.
Yeah.
I mean, we're talking about the 1980s, early
Right.
80s that we began to be familiar with the disease.
Sure.
And so I'm just surprised that people are still not
Oh, yeah.
understanding. But I also remember that we also had that stigma surrounding cancer.
Yes.
And it went away.
Yes.
So hopefully people
People
will,
used to whisper that word.
Yes, they did. And now everybody's like, okay, I have breast cancer, I'm all right.
Yeah.
So
hopefully it'll change.
Yes, it must. What percentage of the people who come into positive impact health centers, what percentage have need the behavioral health services?
Well, so we see a lot of people who don't get our health care through them. So we see about, I think we're at around 700 people that get some type of behavioral health services. And we see about 1,200 people in the medical clinic. But they're not always the same set of people. So we have people that maybe they get their health care through Grady, and they may even get their psychiatric medication through Grady, but Grady doesn't have enough resources to do their therapy. And so they come to see us for therapy. And then there are other people that come to our clinic and they don't need behavioral health services. In a typical HIV population, the rate of people that need behavioral health at any given point is around 25%. The rate of mental illness is higher among people with HIV, partly because of the stress of the disease, and partly because of the things we talked about before, where some of the things that cause mental illness are related also to risk factors with HIV.
So we want to encourage people to get tested.
Oh, yes.
That's first.
Tested first.
Tested first. But let's tell the viewers how often a person who's already been
Right.
tested should come in.
Right, yeah, you can't just test once and think you're done. Now, it does cover you from birth.
No one and done. Huh?
No one and done. It covers you from birth until, you know, that waiting period. But you do want to get tested if you're sexually active and heterosexual, probably about once a year. If you're in any kind of higher risk group, like let's say you're a man who has sex with men, probably every 3 to 6 months.
3 to 6 months.
Right, and
That's
depending on, obviously, it's also depending on what you're doing. So,
Right, yeah.
you know,
If you're in a
how many
monogamous
partners,
relationship.
you could be
yeah.
heterosexual and having a lot of partners, you should probably come a lot more often.
Yes.
It's not about identity, it's about behavior.
It's about your behavior.
That's
That's
right.
right. Now, you have peer counselors. Are there any support groups that people come
We
to
do have
on a
support
regular
groups.
basis?
Yep.
What are those like?
Well, we have a bunch of different ones. We have some that are specific to addiction. We have some that are really therapy groups. So they're not just peer support kind of groups. We have one that is really popular right now is that we have one for men who have sex with men and are over 50. Which you know, because
Okay.
it kind of combats that isolation and really gets that social support going, so that's helpful. We have a general HIV support group. Periodically we've had women's support groups. It just depends on what feels like it's going to be a need right now where we can really get a group going.
That sounds awesome.
Yeah.
Well, do you have any final thoughts that you'd like to share with us?
It's just really important to get tested and treated, because I think most people don't know that if you have HIV, you can live a completely natural lifespan. In fact, one of the ironic things is that people with HIV actually tend to live a little bit longer.
Wow.
Because they go to health care, and you have a lot of men who don't have HIV who ignore the doctor.
And you can't drag them to a doctor.
Right, you can't drag them to the doctor.
You can't drag them to a doctor.
It's not,
Yep, been to that
right.
movie.
So you
Yep.
can, I mean, I think that's the message that needs to get out, is that
Right.
you can live a normal, healthy life with HIV, and through testing and prevention, you don't ever need to get HIV.
And the tide is turning. People don't have the really negative feelings that they used to have about it, and those who do just need a little bit more information.
Yeah, because there's no need to have any.
No.
none.
It's
And I think what the
just
other
a
thing
disease
that
like all
people
the
don't
others.
understand is that people that have been treated, they're just it's not even possible, for the most part, to transmit HIV. And that's something that really needs to get out, because I think sometimes the way the stigma manifests is people are using, plastic utensils and all this kind of stuff. That just needs to stop. There's no need for that. You don't need to fear people with HIV.
All right. Well, Dr. Davies, thank you so much for being with us. When we come back, we will have contact information on Positive Impact Health Centers, and we'll have some final thoughts. We'll be back in just a moment. We hope you've enjoyed today's Healthline topic, which dealt with HIV/AIDS and the services the county offers. Now, while the virus continues to be a major health threat in Fulton, the county is making progress in preventing the spread of the infection, and especially in treating those who have it. The key is for everyone to know his or her HIV status, meaning if you haven't been tested, do that on your next visit to a health professional. Positive Impact Health Centers is just one of the many agencies working with Fulton County to get a grip on the HIV/AIDS epidemic. Now, you can learn more about HIV testing by calling Positive Impact at 404-589-9040. Thank you so much for watching. We'll see you next time right here on Healthline.